Hello everybody, this is Jim Berkland, Executive Editor at McKnight's Long-Term Care News, and I'm coming to you from the floor of the American Healthcare Association National Center for Assisted Living Exhibition Hall floor in Las Vegas. And I'm very glad to say we have a special guest here. We have James Yersh, President of PointClickCare, and we're going to talk about some exciting new announcements that they have. And so first of all, James, welcome.
Thank you, Jim. Pleasure to be here.
Now, PointClickCare just unveiled its new branding at this show, and I guess one of the questions I'll throw in first of all is, nobody knew anything was wrong, so we don't know why that's happening. Can you tell us a little bit about it?
Well, I think every now and then you just need a refresh, and you really need to sit back and think about, the company, its mission, the mandate, and how we deliver what we need to deliver. Obviously coming up with a simple mission statement, to help every provider provide exceptional care as part of what we do, simplifies the rally cry for what people know us as. And below that, we definitely have different ways that we can help them, either through technology, through some process expertise. Of course, everybody's favorite buzzword, Jim, AI these days, and how, our own views on how that can help practitioners do what they do. With that, you take the opportunity to just kind of refresh at the same time. A new color scheme, and I don't know about you, I'm colorblind. So as far as anything color-wise, that's not my forte.
It's a good one, take my word.
But definitely, if you went to our website, it was probably a little bit clunky. And it just shows, as a company has grown, that eventually you have to take a step back and just make sure you have one common purpose, that people can understand how you can help them deliver what they do, because in the end, it's about the residents and how the providers use our tools to deliver the care that they need to for the residents.
Well, now I'm glad you mentioned that, because it's important to note that providers are the center of your focus on this. How did you come to decide to do that?
Well, I think if you looked at it historically, we always focused on the resident, but obviously the residents don't use our tools. And if we're thinking about tackling problems like care coordination, you obviously have to mend the fences between different care settings. But also they're the people, that are bedside, that need to spend less time hopefully doing administrative things, which will give them more time to be able to, provide bedside care. So with that, just actually having people who use our technology even as the faces of our brand, I think was brilliant. Wasn't my idea. Definitely can give the marketing team credit for it, but they're actually walking around the booth here and they're so proud to wear the PointClickCare new green, I guess I can call it that, in and around, this is what I do, this is what I care for. And then, so don't trust us as a company, trust the people that use our technology to do what it is that they need to do. And of course, in today's regulatory environment, Jim, and everything that's being asked of the providers, we need to help them be more efficient. They need to focus on the care, the quality of care. We should be able to bring them tools that changes their lives.
Very good. Now let's switch gears just a little bit and talk about your new product, Chart Advisor. Uses artificial intelligence. It just helps providers in a variety of ways.
Yep.
Can you focus in on key ones you like?
Well, the Chart Advisor product, again, it came to us as part of a hackathon internally, where we just get all of the people who work around our product to be able to think about the next best idea. And then from that ideation, we showed it at our summit. When was that? 6 months ago or whatever that was. And now we actually have this thing in front of a few customers. One of the things that our customers struggle with is ensuring that proper documentation exists, especially for, let's call them somewhat catastrophic events, like if somebody falls. If you think of the regulatory environment, they have people that come into their buildings, the surveyors, that if something didn't happen in their world, if something wasn't documented, Jim, they say it didn't happen. So even if the nurse provides the care that he or she needs to, if it's not documented, it doesn't happen. They have to do it within a certain time frame. So what this tool allows somebody to do is, at the end of a shift, at the end of the day, or however the customers want to use it, run the algorithm that the models have been trained to do and pick up keywords like fall and see if a corresponding fall report has been associated with that. And if not, it'll flag it as an action item that with one simple click, the nurse can get assigned a task to go do that. And all of a sudden, compliance, regulatory, litigation, all those things that kind of cost the organizations money, they now have kind of a out of the mayhem solution, I call it, because obviously nurses do the thing and just there's so much going on in their world that they don't have time to document or they forget to document. So it's just a tool that's there available for other personas within our customers to go back and help boost the compliance, make sure it's documented to avoid penalties, to avoid litigation or any other nasty thing that can come out of it.
Okay, now I'm really curious, with AI taking such a big part of it, how does PointClickCare ensure that the product is used ethically and it does improve patient care?
Well, we view it, first of all, as something that should supplement the workflow as opposed to replace any of the practitioners that are involved in that. From the very beginning, our CEO, Dave, has been very clear that we're going to do it responsibly in a trustworthy way. We actually have our own internal privacy and security teams involved in the working groups that are dealing with the large language models and all the different AI things that we have ongoing. But really it's there as a supplement and another tool to, again, help them do what they need to do. It's been interesting, Jim, as we've gone through this, that sometimes people just don't trust AI. And some of our prototyping has the word like AI assistant in it, of how we're thinking about a tool for the nurses to actually understand what's happened with the patient in the last 7 days. It was a button at the top of the screen and the nurses were actually afraid to click it because they don't trust AI. So if you think of the change that we made, we would just take that, and if you just made it a tab at the side of the screen, that just brought it up for them automatically, they would probably use it and read it. But the fact that, they have to click on that button, everybody has a whole bunch of apprehension to that. And so we go through the testing with our customers and make sure that they're comfortable with what we're doing with their data. Obviously, we have to protect PHI and everything that we need to be from a HIPAA perspective. And so we don't also, make this data available to all of the other, tools that are out there where the data would be public. That's just a total non-starter for us.
It really is a dynamic time with AI, isn't it? I mean, it's really an exploration and discovery, and that's just part of the natural process, wouldn't you say?
I think it is, and it's a lot of this stuff, by the way, some of it I think benefits the industry on how they think about things like compliance, how they can increase reimbursement. But some of our operators have their own, I like to say, very technical term, Jim, kung fu.
There you go.
That allows them to be a certain type of operator or specialized in a certain type of case. What they're thinking about for AI isn't necessarily going to work for the operator down the street if, for example, they specialize in behavioral health. So we try and make it available so that it can meet the needs of the masses. But we haven't yet cracked the code, if you will, on how to make it specific to somebody's operating model. We're good enough to say that you don't have to use PointClickCare from, soup to nuts with everything, that if you use half of our footprint, the language models, the large language models will still work. They won't have the same efficacy as if you're using all of our standard tools, but obviously we're not trying to force everything on top of our customers. They'll do what they need to do. They're the experts. We're just there to facilitate.
Great. Now let's look ahead. If I know PointClickCare, there's always something going. Tell us about your innovations coming ahead and how you think they're going to help patient care.
So one of the things that we've done, Jim, we used to be historically organized with senior care as a business unit. And then through the two big acquisitions we did in 2020 and 2022, I believe, we had the acute and payer side. And so if you think of the data and the network that we've accumulated on patients going through an acute setting, one of the care collaboration elements that we're looking for is to share that data when they moved into a post-acute world. We used to run those two businesses separately, Jim. Now we're actually integrating the two of them because if you think about it, to solve that problem, we need to show up as one integrated company as opposed to two that had different business units or different business goals. So if you think about that, that's when I think we can take advantage of providing different tools and different solutions as the transitions happen. So as somebody moves from an acute setting into some type of LT pack arrangement, and as they go the other way, if they do have to go back to the hospital, they do go home, make sure that whoever's taking care of them on the other side has the right progress note summaries, the right discharge instructions, because if we don't get that right, that's when people end up back in the facilities and nobody wants that. It's not a quality of life. And so I think as the different aspects of the world change and that care collaboration becomes more important, I think that's where you're going to see us doubling down in terms of ways that we can help the customers.
Well, just some excellent information, something we regularly come to expect out of PointClickCare. I'm Jim Berkland, coming to you again from the ACA NKL floor. And we want to thank James Yersh again from PointClickCare. Just something you're always looking for on the inside of the business and what we can look for going forward. And I'd also like to thank you for tuning in to this special McKnight's Long-Term Care News and McKnight Senior Living interview. As always, we wish you good health and outstanding days ahead.